We would like to relate the story of Tim, a 38-year-old man who considers himself in good health, although he knows that he doesn't exercise enough and that he has a weight problem. Tim is very busy with work and a growing family, and spends all of his energies competing in the workplace. Although he was an athlete in his younger days, the only exercise he gets now is playing with his children. Tim knows that his father had a heart attack at 47, and he's vaguely aware that several family members had heart problems and diabetes, but he doesn't know the details. At his age, he does not consider himself to be at risk, but he has thought that he should start improving on his weight and exercise in the near future. Tim hears about Genomics to Health, also known as GTH, and decides to check it out. When he enters his family history, he is surprised that his risk for a cardiovascular event such as a heart attack or stroke within the next 30 years is as high as 23%, just from the family history. From the information on GTH, he realizes that to get an accurate long-term risk analysis, he needs to have several laboratory studies. Tim has not been to a doctor in 10 years, and he doubts that he has ever had some of these laboratory tests done. Tim decides that as long as he has bought a membership in GTH, he might as well go to a doctor, get a checkup, and have these tests done. The doctor's checkup finds that Tim's blood pressure is elevated and that he is significantly overweight. The doctor is reasonably concerned and suggests a revisit to recheck the blood pressure and suggests dietary changes. A week later, Tim gets a call from the doctor's office that he has several abnormal tests and that he should make another appointment because he needs treatment. At the second visit, he is informed that he has diabetes, hypertension, and dyslipidemia. The doctor suggests making a concerted effort to lose weight and increase his exercise. He also advises medication for each of these. Tim does not want to take medications. He is convinced now that he has to change his lifestyle and improve his health. He chooses to work on his diet and exercise and recheck his laboratory levels in 3 months. He enters all of his laboratory results in GTH and is absolutely shocked to find that he has 10% event risk over the next 10 years and a 94% risk over 30 years. He is now really worried and vows to himself that he will be religious with his weight and exercise. 3 months later, he has lost a little weight and his laboratory values have slightly improved. His doctor continues to advise medication, so Tim relents and begins to take medications for diabetes, hypertension, and dyslipidemia. 6 months later, Tim is doing well with continued weight loss, a good exercise plan, and his tests are much improved but far from normal. He has now dropped his 10-year risk from 10 to 8% and his 30-year risk from 94 to 76%. 8 months later, progress continues. His GTH risks are now down from 8 to 6% and from 76 to 58%. Tim and his doctor decide that more intensive medication may be in order. 4 months later, Tim continues to do well. His BMI is now normal at 24 from a high of 31. His GTH risks continue to improve from 6 to 5% and from 58 to 46%. Tim and his doctor are pleased with the progress, but would like to see the maximum possible decrease in his risk. So they decide to push towards normalization of all values if possible. 7 months later, Tim's BMI is 22. His GTH risks are down from 5 to 4% and from 46 to 35%. Tim and his doctor have now managed to decrease his overall risk by 63% over a 25-month time period. They have now come reasonably close to the non-modifiable family history risk. There are some minor improvements that could be made, but a 3% and 28% risk would always remain, as Tim has certain unalterable factors, such as his family history and the fact that he has diabetes, hypertension, and dyslipidemia. In spite of the fact that those diseases are now mostly under control, they have done some damage in the period of time that they were untreated. Genomics to Health has given Tim the information and support necessary for him to advocate for himself and to communicate with his healthcare advisor in order to improve his health and probably increase his longevity.